So I'm gonna have our hygienist Lori come and explain more about the periodontal disease. She'll be right with you. Do you have any questions for me?
No, I don't think so.
Okay, so this is Lori. Hi, Lori.
Hi.
This is Bailey. Okay,
Hi,
so Dr.
Lori.
Martinez had already seen her.
Nice to meet you.
So she needs more information about the periodontal disease.
Okay.
If you could go ahead and explain that to her.
Okay. Okay. How's it going?
Tired.
Tired?
Yeah.
That's fine. So how long has it been since you had your teeth cleaned?
8 months.
8 months? That's it?
10 months.
10 months. Okay, cool. All right, well, let me show you what we see what's going on, okay? So Dr. Martinez came in and took a look, and it looks like he thinks there's some gum disease going on. Let me tell you what that means, okay? So on this x-ray right here, you can see this is your bone right here. You see this little, it looks like a little wing on the side of your tooth?
Yeah.
Okay, right here. So that is a piece of calculus or tartar. Anytime you see tartar on an x-ray, it means it's really thick, okay? Because x-ray should show hard structures like teeth and bone. You don't see your gum tissue or anything on here, okay? So the fact that you can see this piece of tartar means that it's a really big piece, okay? This bacteria right here actually eats at your bone level, and so you don't want to have that bacteria there, because if you don't clean it off, then you're going to continue to lose bone, and then bone is what holds in your teeth, so you need that to have your teeth, okay? So you have this area right here, and you can see how your bone's really healthy right here, and then as you go to the front, it kind of starts going down, okay? Also, you can kind of see this photo right here.
Ooh.
So this is actually visually what the calculus looks like in your mouth, okay? They probably kind of started up here and then moved down. You can see how the gums are kind of rolling. That means the calculus has moved underneath your gums. So what we need to do today is we're going to go in, and we'll probably have to numb you up. When I was taking those measurements of your gums, I'm sure it was really sensitive. So what we're going to do is we're going to numb you up. I'm going to go underneath your gums to your bone level, and I'm going to actually scoop from here up and remove that piece of calculus, okay? Then I'm going to see you every 3 months to make sure that this stays remaining. We're going to maintain your bone level right there, okay? So every 3 months we're going to do a regular cleaning, and I'm going to actually take those measurements every 3 months, and we're going to watch those measurements improve. Now, you're not ever going to regrow the bone again, but you can start to regrow tissue, but that means you got to go home and take care of it by flossing. Come to see me every 3 months, and when everything looks healthy, we'll start putting you back in further and further. Okay, do you have any questions?
Sounds expensive.
Well, I'm going to get my office manager, Jessica. We have great payment plans. She'll come in and talk to you about how much your insurance covers, and your insurance is usually pretty well about covering because they know it's something that you need.
By then, they only cover like 2 cleanings.
Yeah, so those are called the regular cleanings that you get 2 per year. So those are considered if you're healthy. So if you have actual bone loss right here, then you're actually not considered healthy. You're actually considered that you have periodontal disease. So every 3 months, you also won't be considered your regular cleaning because we need to maintain your bone level. There's no cure for this. You're just trying to maintain it. But a regular cleaning isn't going to be beneficial for you. A regular cleaning is only going to get off what you see right here. It's not going to go underneath your gums to get any of that off. If you don't remove that, then you're going to continue to lose bone, and when it starts getting too deep, then there's not a lot we can do. We actually have to send you to a specialist. Okay, so we're going to grab her. She'll come take a look. You guys can talk. We have some great payment options if you need them, and we'll go from there. Any questions?
I guess not.
Okay, all right. Well, let us know if you need anything, and I will be right back, okay?
Okay.
Okay.